Mindset is everything. We learn that all the time in all different ways, right? Same thing with mental health, but well, not but, and I think it can be an extra level of challenge if it's your mind that's messing with you. How do I get my mindset right? Like everyone's like, mindset, just think positive, just think positive. And it's like, if your brain.
Welcome everybody to the Rally Cry podcast. My name is Angel.
And my name is Tyler.
And you guys are here because you want to learn, you want to grow, you want to move from the past, and you want to live in this moment. And in this moment, we got a guest. Yes, we got a guest. You're funny, Tyler. That face. But before I introduce you to this guest, I want you guys to make sure that you follow us on Instagram at The Rally Cries, and also follow us on your favorite podcast platform and let us know. Give us a review. Is there something that we haven't talked about, or is there something that we haven't talked about enough? And today, this individual is someone that we briefly talked a little bit about mental health, the importance about mental health and how it impacts our relationship with one another and how we can be having a sense of community. And why not talk about it on the podcast? So I wanted to, invite her. And so here she is.
Drum roll.
Maria Medina, right?
Medina or Mead? I go by both.
Okay, so Maria, you always have to say Maria. You can't say Maria.
Maria.
or Marie. And you had to have the accent, the Hispanic culture in it. So
I
Maria.
appreciate that.
Yes.
You could do Mari. Mari or Maria is good.
Okay. I like the Mari. Okay, Mari works too.
See, when you do Mari, that's when it gets kind of a little awkward. Like Mari,
the only person that I'm cool with calling me Mari is Mike, because his island accent,
the Bahamas,
makes him say Mari.
Yes.
So it's still not like if it was like Mary or something, right? Latina, you know what I mean?
Got it.
Other than that
works.
We don't do that one either.
That reminds me of going to the islands. Like they were like, "Yeah, man," and I just love the accents in different places. It's cool.
Yes. And so we were talking about mental health. I know we were talking a little bit before we started. And I want to just let everybody know, like, what do you do and what makes it important of what you do.
All right. Currently my title is behavioral health clinical supervisor. I work at Mercy Medical Center in Springfield, Mass. And what I do is I do the clinical supervision of the behavioral health department. At Mercy, our behavioral health department consists of a couple different branches, if you will, that are on the same tree, where we work together. Our offices are all within the same area, so we collaborate a lot on many different cases. We have an addiction team that helps provide integrated behavioral health and medical care, specializing in addiction for patients who are admitted to the medical floors. We also attend to needs of folks who are either seeking detox or having some sort of need related to behavioral health, which behavioral health includes substance use needs, mental health concerns, a crisis that may or may not be connected to an ongoing mental health condition or substance use issue. And so we kind of do a lot. We really try to meet the behavioral health needs of the hospital, which can be varied and can be many. We have a very dynamic team. The director of our department is a psychologist, Dr. Edna Rodriguez. You may have seen her on Mass Appeal and different platforms talking about mental health and really trying to promote some of the good things that we've been doing for the past several years at Mercy. Prior to me coming over to Mercy, I definitely have to say it was started before me, and I'm glad to be part of the continuing that good work.
Right.
We have an addiction specialist, MD, who oversees and supervises 2 physician assistants that are trained specially to work with folks in addiction. They do a lot of education with the other providers in the hospital as well, nurses, doctors, physician assistants, all of the staff really, to help decrease stigma and increase the healing environment feeling of Mercy Medical Center, because we really do. Mercy, and the Sisters of Providence, the mission is to serve the disenfranchised, the poor, have reverence for everybody, and really the values of the facility that I work in tie in very closely to my personal values and my social work values, which makes it easy, to fight the good fight, because it's not an easy fight.
Right.
You know, I have 6 clinicians that are either master's level social workers, different levels of licensure, or another related field like psychology or education, focusing in some sort of counseling or clinical work. Um, we also have what I feel is a robust internship program now.
Mm,
In the past, I had the ability to take up to 2 interns, and we were able to only take MSW advanced level because of the work being strictly the clinical work on the med floors. You have to have foundational stuff before you can do the diagnostics and things like that, of course. Um, but now, with the addition of the crisis service line and the more need for our services across the hospital, I was able to increase that to 6 students
nice.
this year. And I have 2 from each level of social work education. I have 2 bachelor's level students. I have 2 students who are in their first year of their MSW internship. And then I have 2 students who are in their last year of their MSW program and will be graduating in May. Um,
Mm.
yes. And one of my staff is a former student that I had. And as soon as I had the ability to call back her and ask her if she would please come work with me, I did. And I
Right.
hope in the future I will be able to continue to hire students. I think it's really important as a social worker who had to go through internships as well to pay it forward. And I'm big on education, and I want as many people as possible to be able to have the experience of working with my team, because over 20 years in the field, I've never had such a good and well-rounded team. You know, we work closely also with the psychiatric consult team, which is overseen by a psychiatrist, and we have a psychiatrist who does telehealth on the medical floors, which is cutting edge and has some great pros and some challenges that we've been able to work through since we've had that service, which I think has been maybe a year and a half now. Prior to that, we had someone on site, but was through a temporary agency. And as everywhere else, it's tough to hire every type of position you're looking for right now. So, especially psychiatrists are in high demand in hospitals. So, we were blessed to be able to work with the company. It's Iris Telehealth, and we have a good psychiatrist that's working with us through there. And then four we have 4 nurse practitioners who are on site in the hospitals, and they provide different kinds of psychiatric services. They are able to manage medications or start meds or make changes on meds if folks need them. And sometimes that happens, especially if you have someone who's gone through some tragic medical thing and they're seeing a patient over in the rehab building, because that's one of the services they have as well. So it's a lot of things. We touch almost every.
Having you.
Yeah, and I love
Mhm.
that. I love that because where my clinical skills are solid and I'm good with things that I know I'm good with, then I know when I need to call in the physician assistant because this is a medical thing, or I need to ask the recovery coach to visit a patient, or go together with somebody else, or take a student to show them how to do this because you might never get to see this opportunity again. You know, so it's always something different. Lots of things are going on, and we're trying to do so much good work in a fractured system. You know, we all know that, insurances drive a lot of what is and isn't accessible to people. um we could probably do a whole podcast on another day on the challenges or the frustrations and the injustice in the difference in access between people who have private insurance and people who have state or federal insurance like Medicaid or Medicare. It's
Mhm.
ridiculous.
Yeah, and I really appreciate you really giving us a walkthrough on how you have your team put together and their focuses, and how it gives some form of advocacy towards, your goals as far as like destroying the stigma about mental health, which is like a big thing nowadays, right? I think people look at mental health as in like, oh, that means I have a problem. And many people might think that mental health is just a diagnosis of a disorder, when that's not necessarily true. I know we were talking about it. I like to say that it's a form of mental literacy that you want to have for yourself, so you could have that foundational understanding for yourself of why you may be having certain emotions, and you're able to self-regulate and all those other things, right? But when it comes to the stigma of mental health, what do you think that is the reason why we have this stigma? What is it that makes people so scared about mental health? Why what could it be? You know what I mean? Is it the questions that they can't ask for themselves? Is it maybe it sounds like the lack of resources could be another
Hmm.
thing? What do you think is your perspective since you're so much more involved in that environment? What experiences have made you have a conclusion for it?
Right. I think that's such a good and layered question, of course. I think it's many things. Some of the big things have to do with lack of knowledge and fear. Fear often comes from a lack of knowledge.
Like from the profession, like the professions, or from like the patients themselves,
It could be both. You know,
right?
if I, as a person who is starting to experience things I've never experienced before, like significant depression, and I normally like to get up and, you know, go outside and have a nice walk in the morning, and now I don't want to get out of bed at all. And there may or may not have been something that triggered that, like, you know,
Mm,
and I may or may not know what the word trigger means or what is a trigger, you know what I mean? So I talk in clinical terms because I live it. I mean, in it,
right.
you know what I mean? So it's almost hard for me to sort of back out, but I just think of, like, if you don't know what's going on, a good thing you can compare it to is if someone is starting to have early stages of Alzheimer's or dementia.
Mhm,
You don't really know what's going on, but you know, you might know. Also, you might not. You might know that something's going on. You
mhm,
might know that you might notice that something's different. You might not. You know, different types of like symptoms or quote unquote conditions or feelings is more really what it is feelings, like feeling depression, feeling weighed down, feeling anxious, feeling manic. You're
right.
like superhuman. So I might not have a problem if
Mhm.
I was manic and I want to go shopping and I want to go running and I want to go doing all this stuff because I have all this extra energy. I'm not going to see a problem with that necessarily.
Yeah, and for people that might not know what manic is, what is manic?
Good question.
Yes.
um, Manic or mania is when you have like an excess amount of almost energy and you almost a belief or feeling of superpowers, you know.
Mm,
People can do dangerous things like try to do tricks that they can't normally do, or you know, you might be doing parkour, right, and learning
right.
something like that.
Uh-huh.
In an episode of mania, you might be like, I can jump this building, but you
Mm,
physically don't have the skills to do that yet, or maybe not, you know what I mean? But in your
mm,
mind, you have that ability. A lot of times when people are in a manic episode, there are things like excessive spending. Like, it can be a little excessive, it can be a lot excessive.
mm.
um you know, people dropping tens of $1,000s on credit cards, getting in the car and driving across the country and spending a bunch of money. It's not always like that, and I don't mean to make it seem extreme, but it can be
Wow.
extreme depending on what's going on.
Yeah, and not to cut you off, I think that, you know, that's a lot of us that can even say that we've probably have some tendencies of that, right? I think that sometimes when there's certain you know, habits or behaviors that are, you know, attached to a diagnosis or quote unquote disorder, we think that, oh, I can't, you know, inhabit those kind of behaviors, right? Like a mania could be a lot of times with young adults, right? People that are young. When we're young, we feel like we could do anything. We feel like we do have everything wrong. Nothing can go wrong because we haven't had anything go wrong yet.
Right.
So yeah,
Hmm.
please
And
continue.
that's a great point that you bring up, is youth, especially adolescents. As you know, I know there's so many studies and we're always learning more about every stage of the human brain. The adolescent stage of life and brain is so amazing, and there's so much going on, and you expect lability, like you expect someone to be labile, which is kind of like back and forth, up and down,
Mhm.
you know, all over the place, like super hyper, super energetic. And also we have to be cautious not to jump to diagnosis, not to over
Right.
or
Hmm.
pathologize. And as someone who I identify as a clinician, I'm an independently licensed clinical social worker. You know, I've been working with the DSM for just as long as I've been in the field. Before I even had jobs could where I had the credentials to use the DSM, I was fascinated by reading it.
Mm.
Working in group homes when I was in college still, on the overnight when the kids were sleeping in between bed checks, I had the DSM and I was reading it because that's what I'm interested in. And I'm fascinated by the mind. I think that psychotic disorders are both fascinating and devastating because of what it does and how the brain works and how much we don't know. And there's so much that is still yet to be discovered. And will we ever or won't we? Because is that information for us humans to have, or is that just information for God to keep? You know,
Mm-hmm.
so, and I think with diagnostics, it's very easy. And I remember in grad school when we finally had the class about diagnostics, and I was like, why do we do this? It's so, it puts people in a box. It's labeling, it's stigmatizing. Sometimes we jump too soon. It kind of, if a certain diagnosis can dictate the trajectory of somebody's life. If you look
Yes.
at statistics of a youth that gets diagnosed with oppositional defiant disorder, which is one of my pet peeve disorders, and if you know me, and some of my friends will hear this and they'll be like, "Oh my God, she said that online." I say that all the time because you're setting them up. They're gonna end up with another kind of disorder, and also one of the things it's similar to what you guys were talking about. In you had said it. It's you're who you think
Oh,
who
yes.
I'm who you think no, I'm who I
Yes.
think you think I am,
Yes,
right?
it's the I'm not who I think I am. I'm not who you think I am. I am who I think you think I am. Yes.
That was I was like, and I'm glad you said it twice because I was like, wait, what did he just say? It makes perfect sense. You live up to the expectation.
Yeah.
So if you tell me in my family everybody's obese and everybody has heart failure and everybody, lives a short life, then that's what's going to happen to me. And if that's my expectation, that's what I'm going to live up to.
Yep.
If the doctor tells me
Mm-hmm.
you have cancer and I hear I'm going to die from cancer and I interpret or I'm like defeated by the cancer. Obviously, there's stages of it. And thank God I have not at this point in my life had cancer. Um,
Thank God.
and, but if the people who survive, you can ask them, they say they survive because they plan on surviving. That's it. Like, I'm going
Mm-hmm.
to get through this. Mindset is everything. We learn that all the time in all different ways, right? Same thing with mental health, but well, not but, and I think it can be an extra level of challenge if it's your mind that's messing with you.
Mm-hmm.
How do I get my mindset right? Like everybody's like, mindset, just think positive, just think positive. And it's like, if your brain, because there's a chemical component to it also, you know um there's chemical imbalances, there's things in your body that are off, that medications may or may not be able to help. And any kind of medication for any kind of condition having to do with the mind is really trial and error
Mm-hmm.
Mm-hmm.
on the highest level possible, which in and of itself can be frustrating, especially for youth. They're tired of feeling bad.
Right.
They're just like, ugh.
They
And
want to avoid
people are
it.
telling them, yeah, people are telling them, be positive, think positive, think positive. And I'm that kind of person. I'm going to suck it up and I'm going to get through this. And, I like cry it out. If I got to cry it out, I give it to God. And I try to be a problem solver, like you say. I try to figure out, okay, that's why I'm good in crisis work.
Mm-hmm.
You come to me, you want to die. Okay, I'm not going to freak out because you said that. Like, I'm going to hold that, which is not easy for everybody.
Right.
I can do a lot of kinds of social work. Hospice is not my thing. I can't hold that. That's too much for me. I'm a big baby. I don't do well with grief. I have a hard time with that. And like I can do small pieces of that. That can't be my whole career. But I can talk to people every day who want to die. I can talk to people every day who don't know what to do and they're just desperate and they figured if I come to the hospital I might get some medicine to help me feel better. I might get something, or this is not their first rodeo. And they know if they come to Mercy Medical Center and they see our addiction team or our behavioral health specialist or our crisis team, that they're going to feel like a human being.
Right.
The
Mm.
most rewarding thing I have ever had happen in my career, or have happened, because thankfully it happens semi regularly, I would like to think, is a human being saying thank you for making me feel like my life has value.
Mm.
And I don't do anything special. I'm a humble human being. Yeah, I have a master's degree in social work. That doesn't mean anything. I know people who are doctors who don't know how to talk to people, who don't have a bedside manner. I know people who have run the country or run, I don't know them, but like, you look at, political leaders and people of power, and they don't know how to do those things. I just really, it's about meeting a person where they are. If
Mm-hmm.
you're trying to help them understand. if they don't understand. But the most important thing is listening to them. I do very little talking when I'm assessing. And I like when I'm teaching my students, I explain to them, I'm like, when I said this one sentence and then I let that person talk and you saw me jot a couple notes, because like you said earlier too, I don't really write many notes. And if I'm writing something down, it's usually like I'm writing down this phone number so I don't forget. Or I'm writing down the name of this medicine because it's important, you know, or I'm writing this down because it's important to you. I don't want to forget. But other than that, one of the best things you can do as a social worker or any sort of mental health provider working with people is get good at remembering things. And when you connect with the person genuinely, you do. One of the things that I learned when I taught Introduction to Human Services, I think it was at HCC, like the very, very first class I ever taught. We had a book that was written by Carl Rogers. So very old school. You know, the videos of his group therapy sessions were like the 1980s big glasses with the big hair. They're smoking cigarettes in the it's
Really?
I've
look it
seen
up.
that. Yeah.
You've seen it? I love them. I love those dated videos. But there's three things that he like that he taught and that he worked his practice on. It's unconditional positive regard. Think about that. Unconditional positive regard.
Unconditional.
No matter what you do, no matter if you smell, no matter if you have a home, if you have a car, if you do drugs, if you whatever, it doesn't matter. Unconditional positive regard. Why? Because you're my fellow human. Who am I to judge? Don't even get me started on that. Like, I'm really not in any place to judge. We are all humans. I believe that it's my purpose in life to like really connect with humanity and really help people feel heard, seen, important, valuable. I've seen the beauty that can be recovery. I've seen the tragedy that can be death, to suicide, to complications of substance use or overdose, or both sides. Like you said earlier, to know the good, you have to know the bad.
Right.
I know the value of each breath I take because I know how quickly it could be gone, whether or not I have anything to do with that, even. Which is also why I believe that I got to try to help people not try to do that. You know, to think about how bad you feel when you want your life to end, or you think the only solution is death, or the only way that you can stop these screaming voices in your head from telling you to do horrific things or seeing horrific things that other people are saying are not there. If you think you get to the point where you think that the only way to stop that, to end that, is to die, most of us have had the ability to sit with a thought like that, been in such a bad place. Nobody wants to talk about it. Nobody, a lot of people are not going to walk around and tell you that. I believe every person on this world, on this planet, has had suicidal thoughts at one time or another or more. Death ideation is something that happens kind of frequently and we don't really think about. Like, oh, people with chronic pain. I wish I can't live like this anymore. I wish this would end. I wish if I died tomorrow, I would be okay with that because then I wouldn't wake up in pain because my back has been hurting ever since I had that accident. It doesn't always have to be like something that is a huge travesty or tragedy. It's that chronic piece. And that's why like cumulative trauma is so hard for people to manage, to live through.
Yeah, and I think that understanding trauma is important when it comes to childhood, right? A lot of times, I know we were talking about it earlier too, about if someone was once broken, right? Underneath that is wholeness, and it's just trying to find that area in your life and how it was that made you so whole. And now that you're broken, what can we do to fix that, to make you feel whole again? And going back to your point about, people saying, oh, just be positive, is like, you could tell me to be positive, but you're telling me to get the tools, but I don't know where to find the tools at. And in order to be positive, you had to have some form of structure. And one thing I have for myself was do rampage of appreciation, right? And it's just appreciating the things that you have right now, right? And we could even do it now. I appreciate the light. I appreciate Tyler being here. I appreciate Mari being here. I appreciate these couches. I appreciate these mics because they could get our crisp voices. I appreciate this computer. I appreciate the space that we have here, and we have a roof over our heads. And I could just keep going on, right? And sometimes we may not know what to be appreciated of, but the whole point of the practice is to try to find a little bit of the things, even if the sock on your foot, the sandals, anything,
Right.
just to have some form of gratitude, right? We had to practice. We had to start somewhere, right? Sometimes we want things to be so significant of a change that we expect too much. And too much of that expectation can hold us back in hindrance for our own growth.
Absolutely.
Angel, and I love as you're saying that because going back to what Madi was saying with manic or mania, I feel like social media plays a big part in that, and along with how having people that are in our corner and being in certain surroundings, social media might have inflated or probably possibly gave a hyper exaggeration of like how we may think and function, which is why now a lot of times people nowadays they idolize certain things that aren't really good of value for them, and with the sense of wanting things to change and go a certain way, and let's say the hard work is not being put in, or they're not getting the right advice, because you can't just tell them to do something then that fixes the problem, right? So being that that's the case, death is idolized because they know that there's a sense of control of giving up, and that there's an end to that. So they're controlling the fact that this is their fate, and they didn't like that maybe this is too hard and I don't know how long I got to keep dealing with this for it to change. And social media could just be a indicator that like my life is like this because I'm not like these people. So there's always a reference to how I'm not, how my life is going, because it's just me and not everybody else is dealing with this, where everybody could be having some form of suicidal thoughts. And I love how Madi brought that up. And being that social media does have such a big importance in our life, Madi, what would you think like could change for people that do cling onto social media so much and hold a heavy importance to their meaning through that and how their life is around others?
Such a good question. And social media, oh Lord, I'm grateful that I'm old enough that when I was a teenager and even a early young adult, we didn't have social media, and I see there's benefits of it. I do see that a lot, but I also see that it's a lot of things that, like you said perfectly, it makes everything exasperated and out of control.
Mm-hmm.
And nothing is genuine. Nothing is genuine, and that's well, not nothing. A lot is not, and we don't really know what is. You mentioned earlier, I notice now in the past couple of days, because I got a new phone, that my when I go to post on Facebook, it gives me all of these alternative options, like use AI, improve your grammar. And I'm like, well, first of all, I have good grammar, thank you. But all jokes aside, I'm like, oh God, so now I can completely, and there's there's good things with AI too, right? Like there's some of that is good, but those extreme cases like you're talking about, where that's where they live and that's what the aspiration is, but it's completely jaded and unrealistic. you know it I think for people who, I'm a big fan of baby steps, right? I believe that those small successes are actually the big successes, because without the small successes you never get to the quote unquote big successes.
Right.
You talked about earlier asking questions, like talking with folks in a way, asking questions, like that's motivational interviewing, and sort
Mm,
of pulling from that person, like
mm,
you ask questions that elicit thought, because a true answer that you're going to buy into most is going to be something that at least comes a little bit from you, or you're interested.
yes.
Nothing worse than a therapist who writes a wonderful treatment plan but doesn't sit down with the client to write it with them.
Right. Makes no
That's a
sense.
piece of crap treatment plan, because what if
Mm-hmm.
nothing on there is applicable to the person, or they don't want to do anything? And also, you took all the power. That it's not your treatment plan. Like, if I have a treatment plan, I want to be involved in that. you know? And I think that for people who are really cling to social media, the first thing that they could do to try to help change the perception that they're getting or the image that they're getting or the influence that they're getting is pick better things. There's a lot of stuff on social media that is so great. There are support groups, there are, people who are promoting positivity. They could follow the rally cries and they can watch these podcasts, like, know, like, all seriousness. Like, I was looking through the lists of all of the podcasts that you've done and the topics and the people that are on it and all the things that you guys are saying. Like, everybody needs to be listening to this kind of thing. And so hopefully they have somebody who will tell them, like, listen, there's some good stuff out there, because we know where you focus is what happens, where the grass is greener where it's watered. If I
Exactly.
pour into me, then I'm going to do good and I'm going to actually do better for my kids and my family. But I didn't learn that until I started my own self-love journey after being like back and forth with the craziness of life, and that's okay because that's when it happened for me. So I think that's important too. Like, I'm in my mid 40s. You might think that I have it all together. I don't. I'm human. And also, like, the way I live a healthy lifestyle and self-love and pouring positivity into myself and, trading Netflix for books and following my friends that I follow. I'm looking for the people who are putting book recommendations, and we're sharing that sort of stuff, and we're talking about positivity and manifestation and also reality, right? And like, because I can think in those terms and I can function in those terms, and most days, because I have days where, guess what, I don't want to get out of bed and I don't want to do anything
Right.
because I'm human.
Yeah.
And it's like, uh, and there's some days where I'm like, nope, we're not doing this today. Get up, or maybe I have like a quick cry, quick prayer, put on a good like motivating song to get me moving and go. And there's some days where I'm like, nope, I'm sick today.
Oh, I love that you say that, and everything that you say, I really do appreciate. It kind of, everybody that is listening, we're talking about resources and about how resources and the impact to how our mental health is, and knowing that, we have to be positive if when we're going towards our mental health, because even when we have resources or if we don't have resources, we have to have a positive outlook on getting those resources, if it's from an external or from an internal, right? If it's what we tell ourselves or if it's what other people are telling us, there's a balance of having other people help us, and there's sometimes we had to do certain things on our own. I had my own experience doing a lot of it on my own, and although still having some people that helped me, shout outs to Tyler, because Tyler was, of course, one of those people that were there for me in one of my most darkest times. But then it goes back to what you were saying, being around an environment that puts you to succeed in your own mental health, and everything else that comes with that is important, like trading Netflix for books, which I've been really big into books. And if you are going to be on social media, yes, there's bad things on there, but like you mentioned as well, Mari, there's also good things on there. People that are doing recommendations, people that are talking about good things. Like, I listen to other podcasts as well, and I and Tyler wanted to have a platform to do the same as well, to bring the positivity and the awareness about mental health. I think we talk about mental health as far as like, oh, it's just another thing that we don't really need to know about, right? It's just like a subject, almost like if it's with science or math, which of course those things are important too. But mental health is kind of like having that foundational understanding of yourself, to know what is going on within your body, biologically, psychologically, and social economically, which is literally the
Mhm.
three pillars of mental health. Mental health is a broad range of what's in it. Mental health is just a title. There's branches underneath that. Like, you would talk about addiction, and how addiction, people could be with substance abuse, right? But let's not also forget that addiction is not only based on what people are drugging themselves with, but also what they're drugging themselves with other things, such as social media, such
Right.
as being addicted to someone because it's the same kind of chemical imbalance that they have in their brain, because it's the same sensation. They get this dopamine effect and they feel so happy with this person or this item, that now that when they're no longer with it, they're like, oh, I don't know what to do. I need more of it. And that's why, of course, this month, this is when we're talking about love, right? February is all about being connected with one another. But how can we be able to connect with one another without loving yourself first?
Right.
Right.
Such good points. And when you talk about addiction too, there's so many layers to that, right? And it ties in with trauma. There's never once, and I've talked to I don't know how many people, whether it's people that I know personally or through work situation of one or another, I have never met a person who said that they just became addicted or started to misuse substances because it was fun.
Yeah.
There's something that leads you to that place of not fearing or being more wanting more, what you can get from that relief that you can get from that, and sort of all of the things that go with it. There's so many components of learned behavior, both prior to and during and after active addiction. And it's even the words that we use, they're people say, I obviously encourage people to identify themselves however they choose to identify. So I know some people will identify as an addict. They'll say, I'm an addict in recovery. Or some people will say different things. And but it's not for me to call somebody an addict.
Right.
Because that can have a negative connotation.
Yes.
If you hear a phrase like addictive tendencies, that gives you a certain connotation. You kind of start to think about like lying, stealing, sneaking, selling things to, feed some sort of habit, right? But it may or may not be those things, because there's even before you get to that place, there's so much more. And like you brought up a good point about really trying to quiet down or numb. And part of the quote unquote problem with substances is they work. It's a coping skill that works like almost immediately.
Right.
The problem with it is it has a lot of risk, and it could be lethal, and it takes over because you can't, this is from Brené Brown, you can't numb the bad and not the good. That's not something you can do. So you either, especially with substances, medications, and that's not the only thing that people are addicted to either. That's the other thing. Is like, I think you guys talked about being addictive to toxic behavior, or you could be addictive to toxic situationships.
Yes.
And also you could food addiction. There's addiction to sex, gambling, and they're just as detrimental to someone's livelihood, well-being, happiness, health and wellness as crack or heroin. And a lot of the misconception too with substance use is that heroin kills you. Heroin doesn't kill you. That might be like, what the hell are you saying, Mari? And that's a very controversial thing. And oh my God, I can't believe that lady's saying that. But that's not what kills you. It's not the substance of heroin that kills you. Fentanyl can kill you, and overdose can kill you. Too much of the substance can kill you. But more often than not, what actually kills people, or the things that cause someone to die in addiction, has to do with the complications of the use. Not using safely, or not using we're big on harm reduction. This goes to show you how important harm reduction is, because I work in a Catholic hospital and we give out full harm reduction kits, including clean needles, cookers, there's little filters, there's saline, so that people don't have to go to because people are going to use, they're going to use. That's the bottom line. Whether or not I want to, if I'm battling with myself, I'm like, oh, I do, I don't, relapse is a part of recovery. If someone's going to use, they're going to use. There's very little that you're going to be able to do that will actually change that trajectory, because once you set your mind to something, to most things, even if you're talking about like, all right, I'm going to the gym. Once I set my mind, it's very hard to get me off of that track. And with something that's going to give me so much relief, and it's literally a physical, chemical need, it's a dependency.
Wow.
That's why, like, oh, I love that so much. I don't mean to interrupt, but like, that reminds me of like why it's important to like really be mindful of like what our habits are and the things that we do venture into. And being that, you can't just go cold turkey. Like, if you've been doing something for so long, it's beyond a habit at this point. It's habitual, and it's almost routine, that this is like, if you don't have this thing, that then your day isn't going to go the way it's supposed to. And that obsession with that, it puts you in a standstill where, like, like, without this thing, and in this case a substance, without this, I'm not who I am. Now I've already convinced myself that I need to have this, and that this is the only way I'm going to be able to function. And to be able to have harm reduction kits, as you mentioned, I think that, to not hear that enough, like, I think this may be my first time hearing that, because
Same.
most of the time, if you see this in movies, if you see this, if you've had a therapist, and there's certain therapists that don't click with you right away, so it's a bit frustrating when they tell you to do this and they have this plan already strategized for you, but where is the identity of you in that plan? You had no inclination into, like, what would work for you, because if you're trying to substitute drinking, if you're trying to substitute gambling, now what else can give you that same feeling of adrenaline and satisfaction from, versus whether it's a drug, and you, let's say, playing sports, and let's say having debates will give you that feeling, versus when you're drunk, or maybe if you're high off of something, you just want that relaxation. So maybe debates, maybe playing sports, maybe reading, substituting. Like, how can you find a good substitute, and how can somebody actively be there for you, so that way they're not only listening to you, but then being there in that process where you're reducing that addiction little by little. You can't just break it off right away.
Right.
And I want to add on to what Tyler's saying, because I find it very interesting how it's not necessarily the substance, but is the act of using it.
Right.
And
Well,
I
to be
think,
clear, alcohol kills you.
okay, yeah,
Alcohol is poison. It's
right,
toxic.
yes,
Alcohol,
Yep.
in and of itself, if you consume it and in large quantities for a long time, even moderate quantities, it is bad for you. It will kill you.
that's so
To be
interesting.
fair,
I'm glad you shared that. I'm
I
glad you
just
shared
don't
that.
want people to think like, oh, alcohol's not going to kill me. No, it will kill you. Please don't.
Yes, and
Don't drink excessively, and if you need to detox, get medical help, because it can kill you.
yeah, and it's
Mhm.
also not to advocate just because certain substances doesn't
Correct.
kill you that you can do it. No, we're
Mhm.
not saying that. We're just trying to say that there's a bigger problem here, that there is people that use these substances. It's more on the act of the behavior and the dependency that they have for this substance, right? So it's kind of to say, what Tyler was saying, if I'm addicted to the feeling, right? How it makes me feel, make me more empowered or anything like that. We use other forms of getting that same sensation through people, through certain acts of behavior to get certain attention, right? Because
Mhm.
sometimes, like, people start doing drugs or being addicted to certain things just to get some form of attention, to be seen in some form of way, to have a sense of belonging, just so that they're in a group, right? Because going back to, people want to be connected with one another. Sometimes people do things in order to connect with others, just so that they can relate with them, so they can confide to them. That's why there is
Mhm.
group therapy, and it works for certain people. Or they might need a little bit more of an intimate approach where it's one-on-one, because they want to be able to hear one person hear them out. So it's a lot more confided, in order for them to be
Right.
like, okay, this is a lot more wholesome, rather than getting too many perspectives. And
Mhm.
I think that, you know, when we're able to really consider certain behaviors, it makes it a little bit easier to have an understanding. I think when it comes to having people, do certain behaviors and certain tendencies, we automatically ridicule them and think that, oh, this is this kind of person. Like when you was bringing up the fact that, oh, I like to identify myself as an addict, right? It's their business for them calling themselves that, because it could be that that's their way of motivating themselves to say that, hey, this is what I'm going through. But for someone else to identify them as that is almost like putting it in their face. Like, I know I'm an addict. You don't need to tell me that I am.
Right. And how
So
many times have they heard it in a derogatory sense?
exactly. So from hearing it from an external sense is different from hearing from an internal sense.
Right.
So it's important to hear it outside, but in certain instances, it's only important to hear from the inside, because they have to self-admit to themselves.
Mhm.
And I think that's just so important. And I don't think a lot of people really understand the fact that we shouldn't be ridiculing the people that are having certain problems and say that, oh, they have a mental health problem. No, people that are addicted to anything isn't that they have a mental health problem is that they have a problem that manifests into their mental health. And having mental literacy will make them better at their mental health.
Right.
Mm-hmm.
And thinking of, I love how all of this is building towards, the resources and types of help and things like that. There's a lot needed, of course. And one of the things that I will encourage everybody to do at whatever capacity you think is your ability, if this is something that is important to you and you're passionate about caring for other people and making sure that people feel that we as human beings can support each other, is vote for people that talk about the things that matter to you. There are people talking about advocating for mental health. There are people who are, advocating towards changing up different systems and payment systems for insurance rates and things like that. Like, some of the reasons that some of these facilities are closing is because, for example, the rate of pay that insurances reimburse for detox is disgustingly low. Disgustingly low. And detox is one of the most expensive levels of care because it's a medical, monitored, around the clock process, just as if you were being monitored for a cardiac condition, to which your insurance would not say, I'm only going to pay this percentage of what you're telling me that it costs to monitor this person on a cardiac monitor, for example, right? And so that's part of it. Some programs or agencies that have programs are for profit and some are not for profit, so their funding sources and are different. Some programs, if they're not for profit, they can take patients who don't have insurance because they have funding from BSAS that pays for people who don't have insurance to get detox services. How far down the continuum of treatment do they have funding for the next stage of programming, if you will, is not necessarily there, which is also part of the problem. It's like, okay, I can get this person a detox, they don't have insurance, but then what? I can't get them a therapist, they can't get medication. And some people can get state insurance, some people can't. Some people might be working, they might be, on that poverty line. Not everybody's situation is one extreme or the other. Not everybody has private insurance. If you have private insurance and you need to get services, there's a lot of really nice places. And I think that that's great. They have some specialized units for folks who are veterans. They have specialized units for folks who are like providers in the mental health field. If someone like me needed to go to detox, it would be uncomfortable for me and awkward if I went to the detox where I send patients every day, because I probably know everybody on that unit and I wouldn't necessarily be able to focus on myself. So I could go to a place where other people that probably wouldn't know me, I could go to a different state. My insurance would pay for that. But somebody who has mass health or somebody who has Medicare can't do that. They can maybe get to Carlson if there's a bed. That's the only detox around here.
Right. It almost sounds like too, as limited as there may be resources because of insurances on all those other things, you know, is also not to even lose hope for that either, because I think
Absolutely.
sometimes we can cultivate that. Some of us might not have the fortunate of having a family, so that can also be hard. But it's having the sense of understanding that the people that are around you is a big significant problem solver to your own mental health, right? You don't want to always be around people that are negative, and putting yourself in an environment that where you can confide in and talk about what is bothering you is important, and then having people that are around you that support that. But what happens is that we live in a society now, like, people, as mentioned, ridicule one another. They judge people by the book of its cover and think that there's something wrong with them and automatically stigmatize them and saying that, oh, this is what you are, this is who you are. And now we have a loss of identity, or an acceptance of the identity that was put onto us.
Yes.
And just keep saying like, okay, this must be who I am, because it's just back to the point. I'm not who I think I am or you think I am. It's just who I think you think I am. So we're assuming that what other people think of us is who we are. And that's the biggest part. And I think that's what makes us want to be codependent on certain things, because we lost our own identity, and our identity is now focused on what people said we are. And that's why it's important not to identify who they are, like, oh, you are an addict or anything like that, right? You shouldn't ever say that, because it's not your place for that, right? It's their place to admit that, because that's an identifying thing. It's almost a derogatory term. It's almost name calling, as mentioned.
Right. And that makes people more isolated. If they're not already isolated,
right,
they're going to feel isolated. They're going to feel like everybody has that opinion of me. They're going to feel like shame, guilt. Again, I go back to Brené Brown. Watch her TED Talk on vulnerability and anything that she writes or talks about, because she's really about that human connection and how much we need to be vulnerable to have that human connection. Yet we're all potentially terrified to have that connection because we have to be vulnerable and we are opening up to judgment and the things that we've heard. And again, most people with addiction have some sort of cumulative trauma, and like thinking about toxic relationships and toxic traits that you guys were talking about in your last podcast. Think about the extremes. Think about the violent. Think about the disorganized. Think about the hectic, maybe absent. Maybe you're by yourself as a kid. Maybe if someone shows up, they're drunk, they're high, they're hitting you. There's other people coming in your, like, I mean,
tons.
The possibilities are endless, right?
Yes.
And so that's the sort of stuff that's already got somebody isolated. You're already vulnerable. So when people are like, I don't understand why they don't just like call a therapist, it's not that easy, because that's never been in your thing. And also generationally, again, I'm Gen X. What happens in your house stays in your house. Don't go talking to other people outside this house of my business. Like, what do you mean? Da, 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 da. When we had dare officers, I would go home and I would be like reciting some of the things that I was hearing from the officers at school. And then I would get like yelled at by some folks in my family because they're like, oh no, that's not what I'm doing. And da, da, da. I'm like, but no, it's, the school was teaching me to figure out what's going on in my house, or like in other people's houses that I was around. And it's like, I would like to think that there's some less of that now. I know that it's not necessarily the case and it's different. One of the things that I think us older generations tend to be like, oh my God, social media, everybody's saying everything. Oh, and it's kind of like, how much is too much to share? How much is not enough? But it depends on you. What you're comfortable with is cool. What I'm comfortable with is cool. And if I have a problem with what you're sharing, then it's my choice to keep watching it or not. Kind of going back to choosing positive things. And like, you have the ability to unfollow people or to not look at their stuff or take a break from them if you don't want to like delete them, because maybe it's a family member that you love and or whatever. You can do that and you can find different places. One of the things that's good about social media too, and it's gotten better over time because it hasn't been this good in the past, is it's a place you can cry out for help.
It's true. Absolutely.
It's a place you can cry out for help. If you start to search ways to die or things like that, the first things that are going to come up is a bunch of the national suicide hotlines. They've built those technological pieces in. If you write something that's like potentially of suicidal nature online, there's people that are watching somehow. You guys probably know more than I do or how that works, but like, that's cool to me. That's a good use of technology. If there's one thing that I could tell anybody, any human being, again, you don't have to be identified as something or not identified as something or chronically seemingly struggling. You're not alone. Even if what has happened to you or what is happening to you has never happened to anybody else in this world, and it's the first time that it's happened, you're not alone, because there's people who want to be here with you, even if they don't know you. The fact that this podcast exists and others like it, and that some of the guests that you have coming on have been young men and influential men in the community, and like that you guys are talking about feelings and positivity. This is so dope to me.
Thank you.
Shout out to Mike. Deliver others positive experience.
Yes.
Stay sucker free.
Yes.
It's so awesome, because when I talk to a man at work and they're like 60 years old and I'm trying to tell them it's okay to feel your feelings, and they look at me like, mija, what are you talking about?
Mija.
And I'm like, no,
that's not like George Lopez.
Right.
You know, it's not something that is it's known to them,
It's okay.
and that's
Mhm.
okay. I can be like, yeah, believe it or not, it's like the cool thing now. You know, it helps when I have men around. Like the recovery coach that we have is a male, so that's helpful because you know, I don't really look like someone who's got a good male perspective, and I don't want to pretend I do. You know,
Mhm.
I know what I know, I know what I don't know, and I know where my strengths are. You
Right.
know, and so I want to be able to genuinely come to people as I expect them to be genuine with me, but call out for help. There's so many different things that you can do now. Obviously, if it's ever an emergency, you can always call 911, worst case scenario. Or if you in the moment you forget, you don't know what to do, you can always call 911. The people on the phone are trained, they can tell you like if there's different things. They now nationally have a mental health kind of 911, which is 988.
Mm.
That's active now in this state also. And
Nice.
so you
Oh.
call, yeah, you call 988, and it's like mental health 911, if you will.
Huh.
It's a mental health
I
hotline. You can
Look at
love
call
that.
that.
for
Look at that.
anything. If you need to
Wait, like,
talk to
oh, that was
somebody,
great.
yes.
That's cool.
If you need to talk to somebody just for support, that's the other thing. There's a lot of misconceptions, right? Like you think of, so now we have community crisis or community behavioral health centers. They used to be like a community crisis center, but within a community behavioral health center, which there are different ones in the valley. There's BHN, Behavioral Health Network. There's CHD, Center for Human Development. CSO, Community Service Organization, is another one that is around here, and there's other ones, you know, in the different areas of the state. But you can call there or show up there 24 hours a day, 7 days a week. And again, if you need to talk to somebody, if you need support, you can just call and say, hey, I'm stressed, I can't sleep. Anything like ideas to help you relax. When I was working in a, you know, on a crisis hotline, it was not uncommon that I would do deep breathing exercises with people over the phone. Because you'd be
Hmm.
surprised if someone would just do it with you, it doesn't seem so
Mm.
silly. You know what I mean? Like let's deep
Yes.
breathe, you know?
That's
So
so
you can
true.
call, yeah, you could call for support. You could call if you're in a crisis and you need to see somebody. If you feel like I want to die and I don't know what to do, you know, whatever the case may be, if something has happened, you can call. If something has happened, if you've like taken pills or done something to hurt yourself, or you're with somebody who has, or you're talking to somebody on the phone who tells you they have done that or they're going to do that, that's a 911 call. You know, when in doubt and it seems urgent and like someone could die, that's a 911 call, and they'll guide you through the process. But you can call, set up an appointment, go have
Mm.
someone see you. They can go out to your house, you can go to the setting. If it's ever an emergency or there's a medical need, you can get an assessment in the emergency room. There's clinicians in all of the emergency rooms that are either stationed there, or some of the hospitals may have a outside team that comes in. But there's a lot of people doing a lot of good work. You know, you can call the community behavioral health center if it's not about quote unquote mental health, and if you're looking for detox. um BHN, Behavioral Health Network, has like a central access line, so you can call one phone number. If you look it up online, even if you call what used to be their crisis line, 413-733-6661, that brings you to their central access line,
She just gave it to you guys.
four
Just
one three
Like,
seven three three 6661.
there you go.
That's
for
Behavioral
free.
Health Network central access line. Yes, if you need to know about what kind of services they have, you can call there. They'll talk to you about that. If you need an urgent service, if you need to get connected, if you need an appointment for a therapist, if something's not urgent, you can call that and they'll direct you in the right way.
I love
Um,
that.
yeah.
And honestly, like I love how we went from talking about how we had limited resources and then giving some resources. Like, hey, we might have limited resources, but guess what? We're creating these resources and
Yeah.
letting everybody know, like, hey, you got to be vulnerable and just ask for help, and then that's where we can help. You know, when
Right.
all you have to do is open your mouth. Like people say, you know, a closed mouth can't be fed. So it's
Hmm.
the matter of opening your mouth. And as great as how we're having our conversation, because I think that we might have to have a part two, part three, four, five, six, seven, eight,
I'm
nine.
down with that. We could have
Be-
like a segment.
yes, because I think there's so much more that we can learn from you. I can learn from you, and I've already learned.
And I learned from you guys too. Like I'm big on that. Everything is mutual education for me. You know, I
Yes,
may be twice your age. and have a lot of different experience, but my experience is different than yours, and my outlook and
Right.
perspective is different than yours.
Yes.
My generational outlook is different than yours, and us coming together is a beautiful thing. I think that that's part of how we do this. The
Yes.
old joining with the new, you know, like we share what we know, and you share with me your new perspective that kind of helps
Mm-hmm.
shed some of the things that, like, my generation is pretty closed mouth. It's only now we're starting to open our mouths, and then that's why you see that there's an increase in like need in some instances, because people are starting to get that we can talk.
Using the
People are
voice.
starting to say, yeah, you know what, I need help with this.
Right.
Mm-hmm.
Everybody needs help with stuff. You see people online and they're like, if it like you see someone's success story online. Me, for example, I lost 80 pounds and I maintained 80 pounds of weight loss. That shit wasn't overnight.
Mm-hmm.
Excuse my language, but
Yeah.
it was not easy. It's not easy. It's a lifestyle I choose to live. But
Lifestyle.
and like you said, it comes from changing the inside
Mm.
before I could change
Mm-hmm.
the outside. I lost a
Yes.
bunch of weight multiple times in my life. I gained it back because what was missing was that
Mm-hmm.
mental literacy, like you say,
Mm.
Angel.
I
I
love
love
that.
it. You know, and
I,
and
I,
like on top of that, like I just want to say, like, going with that, like, lifestyles, good habits, and good people, just being able to keep your head up and moving forward. Because I think that when we try to limit ourselves and look at things as like this is just what it is and nothing can ever change from that, with a voice, it just takes that one voice to like get through to somebody. And the same way, like how everybody has their favorite artist, everybody has maybe some individuals that they prefer talking to. It's just some people's voices, the frequency or the vibration, it could just reach them a certain way versus others. Whether you're licensed, whether you're a clinician, whether you're a doctor, whether even if you're a firefighter, some people's point of views, their mindsets, the things that they went through, could just speak pure bliss to them because of that. And everybody just keep on searching for that one true somebody that could be your soulmate. Who knows?
Right.
yeah.
I think that the big thing, the mistake a lot of quote unquote professionals make is depending too heavily on the formal education piece. Not to take away from formal education. I believe heavily in higher education and continued education. I think it's important. I think it's necessary. I think especially people of color, obviously historically, have been kept away from, literally, and stripped of education, literacy, language,
Resources.
existence.
Yes.
And so, you know, I don't take that lightly. So
Mm.
I want to educate. You know what? Yep, I got my MSW, but I promise you, the kind of clinician I am, the kind of human being I am, comes not from that master's degree. That master's degree is valid. I
Mm-hmm.
worked hard for it. I did good. Like, I'm smart. I'm a smart woman, and
Mm-hmm.
that's also okay to say. Be confident in your abilities and the hard work that you put in to be where you are, because what society will do and what people will do is try to tell you in sort of like a microaggressive way.
Oh, I love that you say that. Yes.
Oh
I just
yes,
learned about
that you don't
microaggression.
belong here.
Very subtle too.
It's not until the past 5-6 years, I'll say, um, that actually started to realize in my career that I was as valuable as I am, and that I have a lot to bring. Because prior to that, I was in teams and agencies and under the direction of people who either they themselves believe differently, like, oh, you're so lucky to have this job. Like,
That's
you
microaggressive.
shouldn't you shouldn't say that's not a good idea, or you
Right.
shouldn't ruffle feathers. I'm the wrong one. I will ruffle all day long. I'll ruffle a person I'm working with, like, to try to help them. If they're not, if we're stuck, I'm gonna try to get you unstuck. You can tell me to kick rocks, and I'll be respectful, but I'm not helping you if I don't try to challenge you. And I didn't realize that I was being held back. I didn't realize that because of previous limited beliefs that I had. So again, self love, self education, self advocacy. I didn't realize that I was acting as if I was less than the people around me. And actually, you could argue that I have more to offer, because not only am I as smart, book wise as the people that I sat next to in classes, me and others like me, I'm not the only one, obviously, have a much different life experience than a lot of those people. That gives me knowledge and understanding and ability to empathize that only comes from God. That's the other thing. Is I'm not this is I don't do what I do. I don't these ideas are not mine. I listen to what I feel is right. That still small voice that guides me inside, the Holy Spirit. I do God's work. The work is challenging. Sometimes when I do my best work, I get cussed out. And I still may that have I still may consider that a successful day.
Right.
I may not. It depends. Sometimes I get cussed out and it ends up going well. Sometimes I get cussed out and I'm like, well, I tried. But that's the other thing is I'll always try. I'll always give the person the genuineness, the unconditional positive regard. And I'm always going to try to meet them where they are and help them get to the next step. And if I'm not, I don't want to push them too far. I don't try to convince people. I love when a doctor's like, "Oh, you got to convince this person to go to detox because they're the medical situation is bad, and obviously it will be better if they're not drinking, for example." Like, okay, but the first thing I'm going to tell you is I don't try to convince anybody anything. That's not my job. That's not my role. I can bring you information. I can bring you some respect, some courtesy, some empathy, a place to even sit. Sometimes people don't want to talk. And if everybody comes and talks to you about, okay, I'm here because I'm in withdrawal from alcohol. So the doctor in the emergency room is going to talk to you about the withdrawal from alcohol. The triage nurse is going to talk to you about the withdrawal from alcohol. Then the doctor who sees you is going to talk to you about the withdrawal from alcohol. When the doctor from the addiction team is going to come and talk to you about medication for your withdrawal from alcohol to help you feel better. And then I'm going to come and talk to you about that too.
Right.
I don't do that. I'm like, hey,
Mm-hmm.
I work with this team. I can talk. I can provide you some support, some information. We can make referrals. I kind of give them a nice, warm introduction to the things I can do. If now's not a good time, I can come back and go from there.
Yeah.
It makes a big difference because I gave them power. I gave them control. I gave them options, choices.
Right. Right.
And then that makes a world of difference. If you tell me I have to do something, versus asking me if I want to do something, that alone is going to make a difference in my response.
I agree. Yeah. I think we have a little bit of time. I'm just trying to make sure as far as yes. Okay. Just making sure. All right. I wanted to wrap up. Coming to a wrap up. Me and Tyler always like to have 4 questions that we ask you called Rally for Cry. So we ask every guest this. You can answer it to 1 word minimum to a sentence maximum. If it goes a little bit over, that's okay. So to my first question, it would be, what is the best advice you ever received?
Speak out.
Speak out. All right, that's valid enough. As much as we've been saying it,
Simple.
speak. Oh, okay. I love that. Next question would be, what is the worst advice you ever received?
That's the classic pull up your bootstraps kind of thing. Like,
Mm,
I did this, so you could do this.
yeah.
Just do it. I can go with, but it's a different sort of just do it. Like, there's no reason why this should be hard for you because it wasn't hard for me.
Right.
Coming from like a
That's
middle-aged white man, and I'm a Latina from Holyoke.
right. Right. No, I love that. That's a valid one. I like that. Yes.
No, that definitely is. I actually had
Or
a
actually,
great
like, I
question.
understand.
Yeah.
I understand how you
Mm,
feel. Don't say that.
Yeah.
Never say that shit.
Yeah.
yeah.
I could be like, I hear you. You can
Yep.
say that, or I
Yes, that's
see
a good
you.
one. Mm-hmm.
That yes. Okay. I
Yeah,
love
or
that one.
I could only imagine how that works for you or how that experience is going for you.
Right.
Yes,
It's
because
always about word
that's
choice.
empathy. That's
Exactly.
empathy in
Hmm.
action is exactly what you guys just did.
Yes.
Yeah,
So
and then I was gonna say actually, who was your biggest role model that moved you to the career that you decided to do now?
ooh, that's a good one.
Yeah. Dun, 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 dun.
Oh wow. That's wow. Wow, wow, wow. Quick version of this. I think there's a lot of people, so I couldn't give just one person. Um, I believe that social work chose me.
Mm.
In future times, you'll learn more about me, and I believe that it chose me. I believe that I have been practicing pieces of social work, if you will, since childhood, just naturally. So that's part of why I believe that God has given me this gift. And there are there's one person that I will never forget, is the one who helped me decide to choose social work over psychology for a master's degree, for example. Because it wasn't until 10 years after I got my bachelor's degree that I even contemplated getting a master's. It wasn't something that was like in my vision.
Right.
So I was like, okay, but now what kind of master's do I get? Because I knew I wanted to level up and do clinical work, but I worked with people who were social workers. I worked with people who had a degree in psychology. And so I asked Sarah Kendall. She was one of the supervisors at the crisis team at the time. I then went on to work with her closely for a few more years, and she's still in the field. She's an amazing social worker. And she told me, which I know is true, and I believe wholeheartedly, in the field with the kinds of work that I want to do and the things that I like to do, social work is a more marketable degree, and you can do more with a master's in social work that I might need a higher degree in another discipline to do the same sort of thing I'm doing now. Um, and I wholeheartedly align with the values of social work. So I think it's to fit, and that conversation with her was very helpful. And she's also someone who encouraged me to go to school. And another supervisor that I had at the time, Gail Vivian, hot ticket, love her. Um, she said it was going to be the hardest and best thing that you ever do for yourself. And if that was not true, nothing is.
I love that. I appreciate Tyler bringing that up. That goes for that third question. So the last question would be, if there was one rule that everybody had to follow, what would it be?
Love each other.
Well said. Just well said. Just love each other. When we could live on valued energy, it's all wholesome.
Spread
Yes.
love and positivity. That's all it is.
Yes.
We're missing out on that now. So like I can only
Yes.
imagine what that could do. Imagine the whole world, a lot more love, less pessimism, less negativity, and less enviness as well. Comparison is a thief of joy, as Angel says.
That's
Yes.
right. That's
And
right.
honestly, I hope everybody that is listening really got a lot of information from this, resources, the understanding about addiction and how it can really be a detriment to our own identity, but the relationships that we could create with one another, I think is important as well, because if we can't love ourselves, if we can't be seen within ourselves, then how would we be able to be seen with other people? How can we identify ourselves if this is who I am as a person? But it's all about that inner work and figure it out for yourself and asking for help and all those other things. It's so important. So we really do appreciate you guys for listening. Again, everybody, Mari Medina, or how was it?
Mead.
Mead. You can say mead. Okay. So yeah, it was definitely a pleasure. I think there's gonna be another one for this because I think there's so much more to talk about and just learn from. And yeah, guys, make sure you follow us on Instagram at The Rally Cries. Make sure you follow us on your favorite podcast platform. Please leave down a review of what you think of this episode, and you can tag us on Instagram as well. Until next time, make sure you take one step at a time
And one day at a time.
everybody, see ya.